Well, as opposed to the hospital, you have an opportunity to provide one-on-one care, and it's more personable. A lot of times in the hospital, you deal with acute situations, and in home health, you have the opportunity to prevent those exacerbations. So I like being on the front end and on the ground and really teaching families and loved ones how to care for these conditions. It's more so take your time, you don't feel as rushed with patients, and even with the traveling part of it is not as bad as I like the flexibility that I have here, and I like the autonomy I have to make decisions that's best for my patients. So to me, it was a relatively easy transition. Educating family members, performing some kind of skilled nursing care, whether it's wound care. Education is a big part of what I do at visiting nurses. Collaborating with doctors, other nurses, calling other disciplines in the field like physical therapy. That's pretty much what I do every single day. I'm seeing a plan come to fruition and to see that outcome be achieved. There's a couple of patients that don't have any idea about their disease or much less how to manage it. So to watch a patient go from always going in at the hospitals to learning how to manage the condition and actually thrive and have a better quality of life than they had before, to me that's definitely rewarding. Definitely flexibility, critical thinking, and I guess most people wouldn't think you would need that in home health, but you definitely do. Definitely people skills and compassion, which is key to every nurse. Every nurse having compassion and empathy for people and able to relate to one another. You are a guest in someone's home. Coming from nursing school to home health, to me, it gives you ability to exemplify what you became a nurse for, which is to help people. In home health, with the vision that visiting nurse has with is to improve the lives of our patients or people that we serve, I think home health allows you the opportunity because you're able to sit down with people one-on-one and you actually feel like you help someone. I mean, it's definitely can get emotional. I mean, you're dealing with people here and nursing, we're not robots. We do kind of become, to some patients as family, and you begin to come to the home and you begin to love the patient. You understand the patient, and to care is pretty much human, and so you do have that emotional attachment and do become personal. But I think the human dignity part really attracted me to visiting nurse because they don't think of the patients as patient, they say person-centered care. And so it takes the mask off the patient, and you're able to see the person and not just the condition. So I like their approach to patient care or person-centered care. Yes, it was one patient I saw. It was a as-needed patient, like a PRN visit, which was not necessarily on the schedule, but the patient called and wanted a nurse to come by there to see them. And sometimes we have those calls, and patients, because they're not as educated, they can tend to be more concerned about something that maybe a life or death situation. So I thought it was one of those cases maybe. So I came to the home to see the patient and realized that something wasn't quite right, that the patient had absolute cause to be concerned. And I advised the patient that he needs to be seen immediately, and the patient's trying to downplay it, like, no, I think I'm fine. I was like, no, I think you really need to be seen like ASAP. I know it's not convenient for you. It's not a 911 situation, but it's something that you definitely need to see a doctor right now. And so the patient called his sister. I waited with him while he called his sister to take him to the doctor's office. I never knew what happened to the patient at that point. And then I saw the patient on another scheduled visit, and he wanted to thank me for saving his life. He had a heart failure condition and was having trouble to breathe. And so the doctor said that he had less than 2 weeks to live with that heart condition. He ended up getting an LVAD, which is an artificial pumping mechanism for the heart, but he wanted to thank me for saving his life. Every visit that you do at home health can potentially save someone's life, and you don't even know it. So I like that part of it. Visiting a nurse would definitely challenge you as a nurse, but you'll definitely grow. And I think as a person with dealing with people that, like I said, various backgrounds and different cultures, that even though you want to help people, in visiting nurse you learn how to help people. And that's most important, because even with the desire to, if you don't know how to, it becomes very kind of frustrating. So I think in home health, we're seeing people from different nationalities and different cultures and language barriers, and you get down to what makes everyone the same, which is everyone's human and health, and everyone has this body that they're trying to navigate. And I think you get down to the base of what we are as humans, and everyone wants to live and be healthy. And so that's one thing we all have in common. So I like that visiting nurse allows you the opportunity to interact with people of various backgrounds, and you're able to help people at the most vulnerable time. So to me, home health is where it's at.